Hi guys, this is just a quick update to tell you what's been happening since the last video, which was I think just before my procedure to have the baby removed, the ERCP. That was Friday the 13th. Figures. Yeah, that wasn't as bad as I thought. They gave me a pessary when I got there, and I had to lie down for like half an hour, well, longer, but they told me half an hour when I got there, to soften the cervix, and I was supposed to get some cramping and things, but I didn't really feel anything, but everybody's different. I think I was lucky there. Then they took me down to theatre about 3, and it happened quickly, and yeah, that's that. I don't really want to go into that too much, but since then I had about 48 hours of bleeding, maybe hardly anything, to be honest. Now it's just since then it's been just spotting gradually, and sorry for like too much information, but now it's more brown and it's more like discharge than bleeding. It's pretty much stopped now, but it's 5 days on today, which is obviously, what day are we now? Wednesday. And yeah, everything's pretty much stopped, and I've been fine. I went back to work Monday and Tuesday, but today and yesterday I had a little bit of pain on my left side, like a stabbing kind of feeling, and it's actually got worse today. So I called the doctor, I called the hospital, and they told me that I should go to the doctors or the hospital or A&E. So I've got an emergency appointment in about an hour and a half at 20 to 6 to see the doctor, because I might have an infection or something, but I'll update you on that. But I also saw my consultant today for a review, obviously after the miscarriage, and he basically said that I need to wait. I can wait for one period to come, which could take about 8 weeks, 6 to 8 weeks, depends. Yeah, we're going to go ahead with the frozen one, because I get a frozen go. So that means that when my period comes, I wait 21 days from that day, and I start back on the buserelin injections, which puts the ovaries to sleep, because they don't need any eggs or anything, because we're using the frozen embryos. And after 2 weeks they will give me some tablets. Oh God, I've forgotten what they're called. Tablets beginning with P that basically help with the lining, and then they scan me. Prognova tablets, and they basically thicken the lining, and then I'll have scans to see when it's ready, and then they'll put the eggs back. I've got 4 frozen that are good quality, they said, and they're going to unthaw all 4 and choose like the best 2 out of all of those. Some might not survive, they might not all survive, one might survive, we'll see. Yeah, so it's probably going to be around March, maybe, because if it's the end of January now, I imagine my period will come around the end of Feb, and then if it's 21 days, it will be in the middle of March, and obviously another like 4 weeks, it will be end of March, April, that I'll be putting the eggs back. So we were thinking of waiting maybe 2 months, but then just seems like ages away, especially because the percentage of IVF is already low, but it cuts even more with a frozen. So it's really just for me to try a cycle in between the miscarriage, and doing a fresh one. If I don't have to do one, that would be great, obviously, but I'm trying to make less stress on the body at the moment. So that is what we'll be doing. I asked him about aspirin, because at the moment he's got no reason to think I've got any sticky blood cells or anything like that, just bad luck with the first cycle. Obviously, because I did get pregnant, we think it probably got to 7 weeks, something like that, because it was only 8.5 millimeters at the 9-week scan, and that just shows probably around 7 weeks or something, maybe. Anyway, yeah, he said if I wanted to take aspirin, I could. He used to prescribe it, but now the studies keep changing, and it shows that it improves pregnancy success but not live birth rates, whatever that means. I don't know. I'm just reading one of the posts that I put on Facebook earlier. Yeah, he told me to take to get 300 milligrams of baby aspirin and cut them into quarters and take one each day. But obviously that works out at 75 milligrams, so I'm just going to get myself 75 milligrams. Yeah, he said it's not going to hurt, but he wouldn't suggest it any longer than sort of 12 weeks into pregnancy if I got pregnant. But that would just, I guess it won't hurt. Not that he thinks I've got sticky blood or anything like that, but he thinks it's probably just one of those things, but something to try. Yeah, I don't know what you guys think about aspirin as generally, because everyone's got different protocols and everything. Also, whoever's used Progenova before, I haven't used that before, so it'd be good to know what that's like. I know a couple of you, I think, wants to be a mummy one, I think it is. I think she did Progenova. So yeah, if anyone has any tips or anything to say about any of those, yeah, so I'll keep you posted on whether I've got an infection, which would be great, because I go back to work. I went back to work Monday and Tuesday with one family because I'm a nanny, and I go back to work for the other family who actually know about what's happened, so I can go there and say, look, I've had an infection if I've had one, and she'll be lenient. But then she's on holiday for 3 weeks, so I won't have to work Wednesday, Thursday and Friday for like 4 weeks, 3 weeks, something like that. So if I do have an infection, I have time to heal. Yeah. I'm having my up and down days. Today is a better day, but last night, as those of you who know me on Facebook, was a bad night. I'm starting to think it was maybe because I was starting to feel a bit poorly with this, my side hurting, but I was just really emotional yesterday and really like feeling sorry for myself. So today's been a better day, especially with all the positives from the my new review, my new plan. So it'll be a few months before I could start the medicine, but at the same time, Zav and I, we can sort of try and be as normal as possible in the meantime, get fit, go and take all the medicines. He told me to take vitamin C, B and D and omega oil and folic acid, but I'm taking all of those in the Pregnacare kit anyway. As I'm sitting here, I'm getting sharp pains. This has been a lifesaver. It's like a heatable, microwavable bean bag, and it's nice because it just moulds into you. So I've taken that to work, I've taken that everywhere with me. Yeah, that's about it for my updates, but I hope you're all well. Feel free to add me on Facebook because I talk on there quite a lot. Yeah, my cold sore's gone, but the skin where it's all dry and it's still red and tight and it's still a bit sore. You can see it there. And I've got my little angel wings necklace on there. So also they don't do testing on my baby. Not until you've had 3 miscarriages. I'm not going to wait to find out to do that. If I had the money, would possibly do a test that we could do on Zav and myself. It's like a chromosome test to see if we've got anything missing. I don't really know much about that, but it would cost about £400, which we don't have. I'm just going to hope that this was just one of those things. A lot of first-time pregnancies don't work. Well, don't go to full term, because sometimes your body apparently doesn't know what to do with a pregnancy. It's like antibodies. When you get a germ, they learn how to kind of fight it. Same with pregnancy. Your body has to learn how to deal with all the hormones to keep the baby there. But also, if it's had chromosome problems, that's probably why. But you just could ask yourself a million questions. But because it's my first miscarriage, if it was like a second one, I'd probably really push for tests. But I'm just going to go with the whole, it was one of those things. Try and see the positives, which for me have been the fact that I can get pregnant. The fact that they told me today that a lot of clinics are doing procedures like D and C's and to clear the uterus, and it kind of helps, and it's shown that some pregnancies have it's helped with the implantation afterwards. So that's quite interesting to know. I heard that today. So any of you that have had the same thing, it could mean that we've got lovely fresh wombs ready, and the next time we get pregnant, it's just going to be wonderful, and it's going to stick. You've got to think like that, otherwise I've got to think like that, otherwise I'll just crack. Everyone's been saying how positive I am, but it's just how I have to be, otherwise because I've been prone to depression before, and I've just found that's the best way. You just have to kind of think positively, because if you start thinking negatively, then it's just a massive spiral, and I wouldn't even get out of bed. So it gives me, comfort to be able to comfort you girls as well. On Facebook, I like to still congratulate people when they're pregnant, because it gives me hope that, everybody has had different experiences, but we've all struggled to get pregnant. And when people say they're, miracles have happened, it is a miracle, and I want to think that it can happen to me too. So I will continue to be pleased for everybody, and obviously it does hurt as well, but I'm just pleased for everyone. I feel like we're all a big family, especially on Facebook. Yeah, so that is it really. I look forward to updating you again. I hopefully haven't got an infection, maybe it's just pains, but we'll see. Sorry I'm rambling a little bit today, but I felt like I had a lot to say. And hopefully I'll let you know, 1, if infections come, and 2, hopefully an update on when my period arrives. So it might not be for another 6 weeks or something. But if you miss me, you could always send me a message. I'd like to hear from you. But I hope you're all well, and I'll speak to you all soon. Bye.